All right, my friends, here we go. This is Kinesiology 230, Chapter 20. We're talking about clients with cardiovascular respiratory conditions. This is presentation one. We're going to have a quick little introduction and then get into hypertension. There's going to be no doubt, I'll let you read this while I talk. There's going to be no doubt when you get into personal training and work with clients, you're going to have clients come in who are hypertensive, whether it's hypertension that you find through doing an intake, or they walk in and they're hypertensive and they're on medication by their doctor. So with that, you have 95% of hypertension occurs without any known cause. And the term for that is idiopathic. And the concept is this, like a person could walk around their entire lives and really not even know that they have this condition because there is no known cause that would lead to one to know or understand that they have hypertension. 5% occurs by secondary factors, and these things are like diet, sedentary lifestyle, those types of things we talked about in this class in length. But this is often referred to as a silent killer because people just don't know. And it doesn't matter if they're young or old because it can affect both young populations and old populations as well, that somebody could be hypertensive and really not know it. Now, the opposite would be hypotensive, would be low blood pressure, which that's also a bit of a rarity as well. But you'll have people who come in and claim they're hypotensive and they need to be sure they're monitored correctly or whatever it may be. But I'm telling you, you're going to be dealing mostly with hypertensive people. So notice this chart. When you look at this, you have normal, elevated, stage 1, stage 2, and it differentiates in here, right? Where normal is below 120 and below 80. It used to be 120 over 80 was normal, but now it has to be below 120, below 80. Anything over 120 and what's interesting here is they talk about the difference here between systolic and diastolic. So if anything over 120 to 129 and still remains below 80 on the diastolic side, you're going to be elevated. Hypertension stage 1 is 130 over 90, and then the diastolic is increased or above 80 to 89. When you get into hypertension stage 2, it's over 140 or it's over 90. So notice how the verbiage changes in here. You have to be below 120, below 80 to be normal. You have to be within 120 to 129 and be below 80 on this side to be elevated. But here it can be an either or. You can either be in 130 to 139 on the systolic side or 80 to 89 on the diastolic side. So either one of those meets the criteria for stage 1. Same with stage 2. If you're over 140, stage 2. If you're over 90 on the diastolic side, stage 2. So the point I'm trying to make here is once you get past the normal stage, it's an either or. You have to have both systolic and the diastolic. These are the criteria for stage 1 or stage 2 hypertension. But I would tell you to be familiar with some of the ranges for future use. Now they talk about different ways to manage hypertension. They talk about exercise, which is best medicine ever, weight loss, which is a result of exercise, nutritional changes, which specifically they don't reduce sodium and alcohol intake. Stop smoking, go with the DASH diet over here to the right, which is in the book. And then you'll also have, in some cases, people will be on medications. And they'll be on, like, say, beta blockers. And beta blockers help with the elasticity, if you will, in the vascular system. But I'm not going to get into beta blockers and calcium channel blockers and ACE inhibitors and stuff like that. Those are kind of in-depth stuff that you can look into. But specifically, what I'd like to talk about in terms of what we do is our scope of practice. And that's we can have people move around. We can have people follow a proper diet. We can have an emphasis on the things they know here in terms of fruit, veggies, low fat, whole grain products, fish, poultry, nuts. And these are all the hallmarks of the diet. Now, even with that, you might have people who have a lifestyle, who are active, and they still have perhaps elevated blood pressure. And it's something where you just have to monitor that. It might be like a creeping type of hypertension where as they're aging, they're losing the elasticity of the vascular system. And that's where the exercise comes in as well. It kind of helps in terms of with the vascularity. But the elasticity of the vascular system, the real influence that we have as trainers is on the exercise size and then pushing for good nutritional changes that'll help them big picture. And I can't stress this enough, but you got to kind of understand the scope of practice here, and I'll let you read through some of these as I'm talking here, where we're talking about beta blockers and vasodilation and et cetera. But the concern you have is with some of the medications, like I've had clients who were on alpha blockers or beta blockers, And in one case, their heart rate's capped. They can't get above 90 beats per minute, no matter how hard I work them. With the medication they were on for their blood pressure, they would never get above, like 135 over 85, no matter how hard I work them. And so, to a certain degree, you have to be able to understand your client and what is hard work for your client. And that comes down to the RPE scale that we've already talked about in other chapters, because it sometimes is difficult to take a true evaluation, at least clinical evaluation, as to how hard your client is working. Their heart rate is capped because of medication. Perhaps their blood pressure is capped because of medication. So now you have to be able to have your client articulate to you what is a 5, a 6, a 7, if you're a 0 through 10, or if you're going to push them harder, it might be like an 8, right? So it just depends on the RPE scale and which RPE you use. So with clients in general, when you talk about workloads, if exercise takes your client to 220, it doesn't matter if it's 220 over 80 or not, or 220 over 150. If your client reaches 220 in the exercise, then you have to stop exercising. All right, so slides over here, one of them should have faded into the presentation, but it was already on top. It's when you look at this in terms of when to terminate exercise with somebody with hypertension, when systolic reaches 220, it doesn't matter if diastolic is at 70, right? Once systolic, that's that top number, reaches 220, terminate exercise. If the diastolic reaches 105, regardless of a top number, meaning your top number could be 150, but if your bottom number diastolic reaches 105, your exercise is being terminated. And your clients also, and I know you're going to see that later on, by the way, your clients also should not be doing a Valsalva maneuver greater than 2 seconds, or preferably not do one. And they talk about some of the other contraindications and comorbidities associated with hypertension, musculoskeletal conditions, neurological disorders, vascular diseases. I would take a moment just to kind of review those and have a little basic understanding of those. So the big thing is, you're going to have clients with hypertension. The question is, when you're working with those clients, the ability to work with them, it's within the context of their hypertension. And some of your clients will be hypertensive, and those folks will be medicated. Others will have no idea. And so it's in your best interest as a trainer to, on the front end, ask questions regarding the ACSM algorithm in terms of exercise readiness and also cardiovascular disease. But when we get into hypertension, that's one of the big questions that some people just don't know. And if they do blood pressure reads with them, and in some regards, they may not be aware that they have elevated level 1 or level 2 hypertension. Might be one of the mindset. So I urge you to make sure you do that quick. And the blood pressure on the front end would be very perhaps find a client to be very adamant about the blood pressure on a regular basis, because it's one of their touchstones starts to achieve fitness wise. All right, guys, sign off.